Let's now run another experiment to see how containment works. But please note that these thought experiments are deliberately kept very simplistic in order to illustrate a certain point. And furthermore, the numbers and conditions used or required in these experiments are totally arbitrary, again in order to illustrate a point. They are not meant to be rigorous or quantitatively accurate in any way. In this new experiment, which we will call the containment experiment, we will again use the same population of 2,000 mice. The first mouse is infected on day 0 with a virus that can cause some sort of easily detectable symptoms. However, the symptoms do not appear until 3 days after the viral infection, and it will be 100% manifested, meaning that if 10 mice are infected, 3 days later, all 10 mice will show symptoms. Another requirement is that an infected mouse can transmit the disease to a new mouse before symptoms start. Or in other words, the disease caused by this virus is pre-symptomatically infectious in this mice population. Finally, each infected mouse can go on to infect one more mouse per 24 hours. 30 student researchers are to look after the mice, and they are to make sure that the mice are healthy. They are also instructed to use the containment measures that we had previously discussed in order to minimize and halt the infection as soon as possible. I apologize for the complex appearance of this table, but hopefully as we go through it, it will make some sense. The first column is simply the number of days of the infection. The last column is the original data collected when the infection was allowed to run its course without intervention, resulting in this curve. When the rapidly rising infection rate with the initial doubling time of 1 day or 24 hours results in this large red area, which is the number of mice inundating the healthcare capacity of the 30 student researchers. Let's now quickly go over the table. First is the possible or theoretical number of infected mice at the end of each day. At the end of day 0, there is 1. End of day 1, there are 2. At end of day 2, 4, etc. I specifically label theoretical because, as we will see shortly, these numbers will be modified as the experiment goes on due to the containment measures. Next column shows what day and how many mice will be becoming symptomatic and will be isolated as part of the containment strategy. Next is the number of mice that is expected to be in contact with a given infected mouse, say during the course of a day as they scurry around finding food. As part of the containment measures, these will be tracked down or contact tracing and will be quarantined. We will assume that each infected mouse will come in contact with 3 other mice. This is totally arbitrary and chosen only in order to illustrate the containment effect of this experiment. Another arbitrary number is among the contacts. We will assume that an equal number of mice will be infected given the same number of mice that are spreading the virus. For example, 1 infected mouse is assumed to interact with 3 other mice during the course of the day, and one of those 3 will get the infection. If we're dealing with 2 infected mice on a certain day, then we will assume that there will be 6 contacts, and 2 of those contacts will get the infection. Next column is the total number of infected mice, or virus spreaders, that will be removed from the general population of mice due to a combination of isolation and quarantine. This last column is the actual number of infected mice each day, once some of the infected mice are kept away from the general mice population due to isolation plus quarantine. Let's now run the containment experiment. The 30 students are to keep a close eye on the 2,000 mice, and they are to carry out all the necessary containment procedures in order to slow, minimize, and halt the infection. Starting the experiment on day 0, the first mouse is infected. It does not yet show any symptoms. The students suspect nothing, and so no isolation and no quarantine. And thus, that first infected mouse goes on to the next day to start spreading the infection. On day 1, the first mouse manages to infect 1 more mouse by the end of the day, and thus there are now 2 mice that can spread the infection. No symptoms yet in either of the mice, and thus no isolation and no quarantine. And the next column records that no infected mice have been removed from the population. And thus, of the 2 mice that can theoretically go on to the next day to spread the infection, in actuality, both indeed go on to the next day. By end of day 2, total of 4 mice are infected, none show symptoms, and so no isolation and no quarantine, and thus all 4 mice go on to the next day to propagate the infection. On day 3, 4 mice infect 4 more, and a theoretical total of 8 mice can carry the virus onto the next day to continue spreading the infection. But something new happens on day 3. The very first mouse that was inoculated or infected on day 0 now shows symptoms, and the students, being very conscientious and vigilant, notice the signs and symptoms of infection and put that mouse in isolation. And so we record 1 for this column. And in addition, the astute student researchers also notice that one infected mouse that is now symptomatic has interacted with 3 other mice, and thus those 3 mice were put in quarantine, even though they show no symptoms whatsoever. As it turns out, one of those 3 mice in quarantine indeed was infected by the original mouse, and thus we now have 1 infected mouse in isolation and 1 more infected mouse under quarantine, and so 2 mice that can carry the viruses are removed from the population, which is the number 2 in this column. And therefore, out of the possible 8 mice that can go on to the next day to continue spreading the infection, 2 have been removed from the population, and now we have in actuality only 6 infected mice to go on to the next day. From day 4 to day 7, the same thing happens, in which the mice that were infected earlier sequentially become symptomatic, are identified, and are moved into isolation. And all the mice that have come into contact with these infected mice are tracked down under the contact tracing strategy and put under quarantine away from the rest of the mice. And after removal of some of the infected mice, thanks to the isolation and quarantine, the last column records the actual number of infected mice that can go on to the next day to continue the infection. Let's slow down a bit for day 8. On this day, 36 infected mice that have progressed from end of day 7 theoretically can infect 36 more mice over the next 24 hours, according to our model. But I choose to record only 35 mice to be infected. The reason for this is that the students have been aggressive in removing mice from the population in accordance to the contact tracing and quarantine strategy, and thus have been removing mice from the population, even non-symptomatic and potentially uninfected ones. Therefore, there is now a smaller probability or a smaller chance for the 36 already infected mice to infect the full complement of 36 more. And I arbitrarily choose a number of 35 to represent this decrease in probability of new mice getting infected. This choice is again arbitrary, but is simply to illustrate the concept of fewer mice now being available to receive the infection. And so now we have a theoretical total of 71 mice carrying the virus by the end of day 8. But of course, 10 mice are found to be symptomatic and are removed to be kept in isolation. These have been carrying the virus since day 5, along with 30 other mice that have been in contact and thus are moved into quarantine, 10 of which are infected. And so the students effectively remove a total of 20 infected mice from the general mice population. So out of the possible 71 mice that could carry the virus onto the next day, in actuality, only 51 infected mice move on to day 9. Days 9 through 12 are modeled after day 8, as the number of remaining mice is smaller and smaller due to aggressive quarantine practice. This many mice are infected, but this many show symptoms and therefore are isolated. This many are quarantined, with some of those in quarantine also proved to be infected. And thus, after isolation and quarantine, the actual number of infected mice that can still move about in the population each day and continue to spread the infection is in this column. On day 13, 81 infected mice can infect another, say, 75 mice because of the continuing dwindling number of the remaining mice population, or for a total of 156 infected mice by the end of the day. But the students identified 68 symptomatic mice and put them in isolation. They also quarantined 204 that came in contact, and of those, 68 are infected. And thus a total of 68 infected mice in isolation and 68 additional infected mice now in quarantine means that we remove 136 infected mice from the circulation. And thus, out of a possible 156 infected mice that can go on to the next day, after removing 136, only 20 mice can carry the viruses onward. Finally, on day 14, those remaining 20 infected mice can theoretically infect another, say, 15 or even 20 of the remaining mice, for a total of 35 to 40 infected mice. However, all of these 20 mice have been infected with the virus since day 11, and all are now showing symptoms, and they are all put into isolation. The 60 mice that were observed to have contact with them also are removed for quarantine, and thus, on this day, the students effectively remove all of the infected mice from the population. Or in other words, zero virus carrier is going back into the population. The students have taken total control of the infection and have stopped it in its tracks. So now that we've run the experiment with containment, what does the new curve look like? Reviewing the table, we are reminded that the column on the far right is the data of a rampant infection, which was allowed to run its course without any intervention. It is characterized by a steeply rising epicurve, its peak found well above the care capacity of the 30 students. Now we will graph out the data of the contained infection, using these numbers in this column, which records the number of infected mice actually present in the population at any given day during the course of the infection. And if you haven't noticed already, the infection course has shortened, only occurring from day 0 to day 14. And when graphing, we get this green epicurve. In the first few days, its slope is exactly the same as that of the yellow curve. But that is because in the first few days, no one is suspecting that an outbreak has started. And so it was spreading totally unchecked, or not intervened, with the same doubling time as the yellow curve. But by day 3, the students were successfully implementing containment measures using isolation and quarantine, and the green curve starts to deviate from the yellow curve. Its slope starts to ease off, signifying that the infection rate or doubling time has slowed down. The following is fairly obvious, but it is worth verbalizing to drive home the point that when there are fewer virus carriers or virus spreaders in the population, as well as fewer uninfected individuals around to be infected, then the rate of infection or doubling time has to decrease. And the infection that has been effectively contained shows a curve that is more gradual and reaching a peak that is pretty much at the capacity for the students to render adequate care, peaking at only 94 infected mice on day 11. And so the students can easily manage all the infected mice without being overwhelmed. Only a small portion is intruding into the red danger zone in this containment experiment, well within manageable level, as compared to a giant red area if the infection were to run rampant without intervention. And then after that, the infection quickly drops off and quickly halted. When enough virus carriers are effectively removed from the population, the infection simply stops spreading. This is containment, and it can stamp out an infectious disease outbreak when effectively implemented at the earliest stages. As had been mentioned previously in an earlier video, managing an infection in a relatively small population of 2,000 mice under controlled laboratory environment with convenient rules is fairly easy to accomplish. But in reality, all the containment measures that we had discussed and that we just saw in action, albeit in a very simplistic and arbitrary thought experiment, are very difficult to carry out. According to Rosalind Egel of the London School of Hygiene and Tropical Medicine, as cited by an article in the New Yorker dated March 11, 2020, it is estimated that in order to halt the spread of an outbreak that started with just 20 infected people, it would likely require public health authorities in a community to trace the contacts of anywhere from 40 to 100 people per week in order to have a reasonable success rate. This would be very time-intensive and resource-intensive work, not to say that it is not worth doing. On top of that, whether containment can be effective depends on how familiar we are with a disease process. That is, how can we tell that the symptoms that a certain patient is seeking medical care for is indeed due to that disease, especially one that is totally new to us. With regards to SARS-CoV-2, remember that it is a novel virus to the human population, and thus when it occurred for the very first time, how would anyone know that 1. It is infectious, and 2. How would one test for it in order to make the correct diagnosis? These are only 2 of the many unknowns in detecting, assessing, and planning for a response against a novel infectious disease in its early stages, when containment measures are most effective. It is these unknowns, as well as understandable confusion, insufficient data and information, or equally concerning, rapidly developing and possibly constantly changing data and information, as well as possible different perception and reaction from different groups in the same society. All these factors combine to create what has been termed the fog of the epidemic, or the fog of the pandemic, which is borrowed from the term the fog of war, which in turn essentially boils down to mean the uncertainty in assessing an enemy's presence and threat, as well as one's own ability to fight against it. Under the best of intention and preparation and resources, containment, especially of a previously unknown pathogen, is extremely difficult. But as South Korea has shown, it is not entirely impossible. In a newsletter dated March 27, 2020, written by researchers at the Center for Strategic and International Studies, led by Dr. Victor Cha, Senior Advisor and Korea Chair of that institution, it is reported that South Korea had its first confirmed COVID-19 case on January 20. 40 days later, it saw its peak daily case count, and by early March, it became the second most infected country after China. However, a mere 2 months after the first confirmed case, South Korea was commended for its effort in containing the outbreak, and this was credited to the following. Early and almost immediate response after the first case on January 20. Speed, a premium on moving as quickly as possible in setting up a testing regime. Transparency, real-time and frequent information dissemination to the public. Public-private sector, enlisting companies with needed resources in a private-public sector response. National organization, organized as a national effort rather than at the city, provincial, or local levels. And thus, to be successful, containment must be done quickly, early, and on a large enough scale to detect everyone and anyone who is infected or could be infected. And there needs to be adequate facilities and personnel to ensure isolation and quarantine of those people in order to stop the spread of infection in its tracks. The researchers noted that although without its flaws, South Korea is among the few nations that was able to execute containment measures effectively. Let's now take a look at a recent research article to be released in the August 2020 edition of Emerging Infectious Diseases, an open-access, peer-reviewed journal published monthly by the Centers for Disease Control and Prevention, but has been available online since April 23, 2020 at the CDC website. The article is titled Coronavirus Disease Outbreak in a Call Center, South Korea, and chronicles a COVID-19 outbreak in a call center located in a multi-story building in Seoul, South Korea. I am not attempting to do a rigorous scientific analysis or critique of the study and the article. I am only aiming to present its findings, as I hope you'll agree with me that it is quite impressive in what it was able to achieve. The many authors of this article come from both local and national levels of health officials and governmental officials, as well as a College of Medicine. Let's recall that one of the pillars of the containment measures is coordinated response. The article describes how the health and civic authorities in Seoul, South Korea, dealt with an outbreak of COVID-19 in a mixed commercial residential building in the capital city. We will preview the story with a very brief timeline. On March 8, 2020, the Seoul Metropolitan Government was notified of a test-confirmed case of COVID-19 in a person who worked in Building X, a 19-story mixed commercial residential building in one of the busiest urban areas of Seoul. Commercial offices are located on floors 1 through 11, including a call center that occupies floors 7th through 9th, as well as floor 11, with 811 employees. Floors 13 through 19 are residential apartments. Most of the patients of this outbreak are employees working on the 11th floor. The architectural plan of floor 11 of this building is included in the article, and the authors have identified the test-positive cases as mostly occurring in one half of that floor. The blue coloring indicates the seating places of persons with confirmed COVID-19 infection. On March 9, the building was closed. From March 9 through 12, the South Korea CDC and the Seoul Metropolitan Authorities offered testing to all occupants, and this includes all office workers as well as apartment residents. From March 13 through March 16, a total of 16,628 text messages were sent to persons who stayed more than 5 minutes near the Building X. The investigating team tracked these persons by using cell phone location data. The messages instructed the recipients to avoid contact with others and go to the nearest COVID-19 screening center to get tested. PUI, or person or patient under investigation, is defined by the investigators as anyone who lived in, worked at, or simply was visiting Building X during the time period of February 21 to March 8, 2020. They identify 1,143 PUIs, and this number includes 922 office workers, 201 residents, and 20 visitors. Testing for COVID-19 was done by nasopharyngeal and oropharyngeal swabs and tested via the reverse transcription polymerase chain reaction, or the PCR assays. The results were available in 12 to 24 hours. 97 people were confirmed to be test positive for COVID-19. And by the way, in the article, the test positive patients were labeled case patients. These patients were, of course, isolated. All of the 97 test positives are office workers, almost all of whom were from the 11th floor, with 3 from 2 other floors. Although none of the residents and none of the visitors tested positive for COVID-19, they, along with the rest of the office workers, were placed under quarantine for 14 days. Let us recall that symptoms of COVID-19 can occur anytime between 2 and 14 days. And the longest time that symptoms can show up from the time of infection is the prudent time duration of a quarantine. Of the 97 test positives, 89 were symptomatic, although the article did not discuss what symptoms and with what severity. The other 8 test positives were without symptoms at the time of the test result, but all 8 were followed under isolation for 14 days, and 4 of these, or 4%, eventually developed symptoms and are thus labeled pre-symptomatic. The remaining 4, or another 4%, remained symptoms-free during the 14-day observation and are labeled asymptomatic infection. The researchers also investigated, tested, and monitored household contacts of all confirmed test positives for 14 days after discovery, regardless of symptoms. 225 household contacts were identified, which works out to be an average of 2.3 household members per confirmed test positive patient. Of the 89 symptomatic test positive patients, 210 household members were followed, and 34 tested positive for COVID-19. This is called secondary infection. Of the 4 pre-symptomatic patients, 11 household members were identified, and of the 4 asymptomatic patients, 4 household members were identified. None tested positive after 14 days of quarantine. In their conclusion, the investigators noted that COVID-19 is a highly contagious disease in crowded office settings, such as a call center. They noted an attack rate of 8.5%, meaning 97 test positive cases in a total of 1,145 PUIs. However, when restricted to only the 11th floor, then the attack rate is 43.5%. And thus, a high-density work environment provides a high risk for COVID-19 disease spread, as well as a potential source for further transmission or secondary infection. They also noted that despite considerable interactions among the employees on different floors of Building X, for example in the elevators and in the lobby, the test positive cases were almost exclusive to the 11th floor. And so the thinking is that for this particular case, the duration of interaction or duration of contact appears to be the main facilitator of the disease transmission. They further noted that the secondary attack rate was 16%, which is the percentage of 34 test positives found among the 210 household contacts of symptomatic patients. However, in the 4% of pre-symptomatic test positives and the other 4% of asymptomatic test positives, there was no secondary attack detected. The investigators noted, however, that this may be due to aggressive and early isolation and quarantine, and thus, at least with regards to this particular case, robust mass testing appeared to have prevented asymptomatic transmission because the asymptomatic test positive patients were able to self-isolate in a timely manner, avoiding viral transmission to household members. The investigators identified some limitations. First, they could not track these cases to another cluster, and therefore could not identify the actual index case patient or the first patient who brought the SARS-CoV virus into the building. Secondly, not all clinical information was available for all confirmed cases, and therefore no detailed descriptions of the clinical symptoms. In the end, however, the investigators noted that this case study demonstrated the power of robust mass testing and contact tracing in effective early containment of an infectious disease outbreak, and are instrumental in interrupting the transmission chain, stopping the infection in its tracks.